Well, good morning, everyone. My name is Kimberly Sue Collis with the Lister Hill Center for Health Policy. I'm very excited to welcome all of you to today's webinar with Dr. Marina Romanello. Now, Dean Irwin, do you want to introduce our speaker for today?
I'm honored. Thank you very much, Kimberly. I'm honored to introduce our guest today, Dr. Marina Romanello, who is the Executive Director of the Lancet Countdown, a collaboration of 43 leading academic institutions and UN agencies tracking progress on health and climate change. Dr. Romanello trained as a clinical biochemist at the University of Buenos Aires, Argentina, and holds a PhD in biomedical sciences from the University of Cambridge. Her research has focused on the impact of environmental exposures on epigenetic alterations and cancer onset. In 2019, she joined University of College London's Institute for Global Health to research the links between climate change and global health within the Lancet Countdown, where she has since been leading on the improvement of its metrics and development of the indicator report. Dr. Romanello, thank you so much for joining us and welcome virtually to the University of Alabama at Birmingham.
So thank you so much for that very, very kind introduction. As Dr. Irwin said, I'm the Executive Director for the Lancet Countdown, which is a very big research collaboration tracking progress on health and climate change. And I'm going to present to you today a bit of the background of what we do, who we are, and I'm going to then focus on showing you the indicators and the metrics from our latest research publication that came out just last November, and whose title is The Code Red for a Healthy Future. So I'm going to tell you a bit why that is the case. So to start from the beginning, talking a bit about climate change, if you saw anything about the IPCC reports that just came out last week, it is now clear in the scientific consensus that climate change is anthropogenic. There's no doubt that is driven by human activity. And these are some graphics that I taken from the latest and the one before IPCC reports, chapter 1, where you can basically see the global anthropogenic CO2 emissions, the amount of cumulative emissions coming from fossil fuel burning. So you can see there's a very sharp increase since the Industrial Revolution in emissions of CO2 coming from fossil fuel burning. And what that generates is directly an increase very, very rapidly of CO2 concentrations in the atmosphere. Carbon dioxide has a very, very long half-life, so it will remain in the atmosphere for thousands and thousands of years after it's been emitted. And the interesting things come from the latest reports of the IPCC, when you can see average global temperatures and how they have so sharply increased since the Industrial Revolution. And here you have 2020 years being mapped in this graphic. But we know that this is probably the warmest the world has been for the last 100,000 years. So this very, very sharp increase, there's no doubt that this is not a normal geological cycle. And the other thing that is very interesting is that they have simulated global average temperatures with human activity and with the increase in anthropogenic greenhouse gas emissions and without them. And you can see how unexpected this increase would have been without the influence of human-made climate change and human-made contributions to greenhouse gas emissions. So we have no doubt that climate change and the global average increasing temperatures that we're seeing are a product of human activity. And this is what CO2 concentrations look like since the 1960s, so continuously increases, absolutely unabated. And this is what our climate negotiations have achieved. So really, really not that much. And why do we talk about climate change in the context of health? I say we, it wasn't me, a report published from our collaboration before I was even a graduate in 2009 looked at the impact of climate change on human health and at the benefits of climate change transitions. And that 2009 report concluded that climate change is the biggest health threat of the 21st century. And that's because it's undermining the very foundations that good health depends on. In 2015, a second Lancet Commission was published, of which the graph that you're showing comes from there. And what that second Lancet Commission concluded is that actually climate change action is the biggest global health opportunity of the 21st century. And that is because through accelerated climate action, we could not only avoid the worst outcomes of a rapidly warming world, but also deliver very strong public health benefits through healthier diets, more physical activity, and transitions to cleaner air and healthier forms of living. So what I'm trying to show you here is the health impacts of climate change and the pathways through which those happen. It's a very oversimplified diagram, of course, but the key take-home message from here is that climate change will have direct effects on health through direct exposure to storms, to extremes of heat, through injury, through flooding. It would also have indirect effects because it's starting to undermine the systems that health depends on. For example, our food systems, our sanitation, our capacity to access services, ecological services and human services. And all of that, the way in which those harsh effects affect us, obviously will always depend on social dynamics and are sieved by our capacity to protect ourselves from them. So a lot there comes into play on the public health infrastructure, which is also undermined by climate change, the health status, vulnerabilities of the population being exposed, and other underlying determinants. And all of this will have impacts on our mental health, our physical health, our well-being, and the social determinants of our health. So the Lancet Countdown is born out of that report that I was telling you about. That report concluded that we need to have some sort of monitoring system. It was 2015 when it came out, same time as the Paris Agreement. And they identified the need for some sort of monitoring system to track progress on health and climate change as we meet Paris Agreement goals, as we reach that 2030 target of the Sustainable Development Goals, and that milestone for reducing greenhouse gas emissions to half their 1990 levels. So the Lancet Countdown is basically a big collaboration of research institutions from around the world. We have many American institutions, as you can probably see in this graph, and also UN agencies, which come together to monitor precisely the health impacts of climate change up until now, and to monitor also what are the health benefits and co-benefits of our response to climate change. And we publish our findings in the form of roughly 40 to 45 indicators that are annually published in the Lancet in reports that get launched just ahead of the UN climate negotiations, the Conference of the Parties, COP meetings, where we try to make this data available to inform the conversation around climate change and to extract and to expose the health dimensions of climate change and climate action. And the very daunting finding that comes from our latest report is that across all of the indicators in which we're tracking the health impacts of climate change, things are very rapidly getting worse. And what we're seeing is that above everything, it is the most vulnerable of every society, of every country, that are being disproportionately affected. So climate change acts as an amplifier of inequities, making those most vulnerable being affected the most, and therefore leaving them in an even more vulnerable situation. And the first thing that comes to mind when we think about climate change has to do with exposure to heat waves, extremes of heat. These are very dangerous events, particularly to people over 65 years of age, to very small children under 1 year old, and also to those living with underlying health conditions, with cardiovascular disease, respiratory disease. And what we're tracking here is exposure of people over 65 years old and children under 1 to heat waves at a global scale. And what we see is that in 2020, there were about 3 billion more days of heat wave exposure in people over 65 and 6 million more days of heat wave exposure in children under 1 year old than in an average baseline that finished just in 2005. So very, very recent. And you can see a very sharp increase, particularly in the last, let's say, 10 years. And in parallel to that, what we're also seeing is that vulnerability to extremes of heat is also increasing in every country. We're grouping countries here by Human Development Index group to track roughly the level of human development. And what we're seeing is that in every country, extremes of heat, vulnerability to extremes of heat is going up. And this is mainly driven by an increasing proportion of the population living in urban areas, urban areas get really hot during heat waves because of the urban heat island effect, because of their reflective surfaces. It is also going up because of an increased incidence of cardiovascular disease, respiratory disease, diabetes, all of which predispose to the worst health outcomes of extreme heat exposure. And also because we have aging populations. So all of these variables are particularly important in the context of countries like the US, when you have very high proportion of urban populations, aging populations, and a high incidence of chronic disease. And obviously the combination of extreme exposure to heat waves and increased vulnerability leads to an increase in heat-related mortality. And what we're seeing, these are very, very rough estimates using a global exposure response function. So these are just indicative figures. But what we estimate is that heat-related death in people over 65 reached a record high in 2019, with 80.6% higher than in the 2000-2005 average because of that increased vulnerability, because of that increased exposure. The interesting thing is that more and more climate science and statistical science is allowing us to attribute these extreme events to climate change, leaving no doubt that these events are driven by anthropogenic climate change. And we have the Northwestern American heat wave last year, the devastating heat wave that made temperatures in Canada reach 50 degrees roughly. I don't know how much that is actually in Fahrenheit. That we have a detection attribution study that says that it would have been virtually impossible without the influence of climate change. Siberian heat wave, the same. And increasingly, we're having studies that are allowing us to attribute the health impacts that we're seeing from these events to climate change as well. And this study that came last year concluded that about 1/3 of all heat-related deaths seen today are directly attributable to the increasing global temperatures due to anthropogenic climate change. But when we talk about heat exposure, it is not only the direct morbidity and the direct mortality, but also the indirect impacts on health. And one interesting thing is that because of the rising global temperatures, our capacity to do work and exercise outdoors is getting increasingly limited. And what we are monitoring here is the hours of potential loss that could be lost or could have been lost as a result of those increasing temperatures. And what we estimate is that about 300 billion hours of potential work were lost globally due to heat exposure in 2020. And the interesting thing is that if you look at these graphs, it is very small, the label, I know, but this teal color is the agriculture sector. And what becomes really obvious is that in the low human development index countries and medium human development index countries, it is the agricultural laborers that are suffering the most, generally very poor, very vulnerable laborers who's very dependent on their agricultural production for food security, the countries of which really depend on that labor for their food security. And if we translate this to earnings, we estimate that in the low human development index country group, these losses could have contributed to losses of around 4 to 8% of their GDP. So not only affecting directly people's capacity to work, food security, but also affecting health indirectly through the social determinants of health and loss of income. And climate change is also affecting food security directly. What you can see in this small graph here on the right is the reduction in crop yield potential as a result of the rising temperatures. As the climate gets hotter, crops mature more quickly, and that means that they have less time to grow, so seeds are smaller. And what that generates is that the boundary of production of crops gets more and more reduced. So while this is not effective crop yields, this is telling us that the climatological boundary for crop production is getting narrower. And what we're also seeing is that the land area affected by drought events is also increasing around the world. And again, we have detection attribution studies telling us that climate change has played a major role in very important droughts that we've seen over the past years. If you look at these droughts, Somalia, Kenya, these are countries where droughts is very closely related to food insecurity. So reduced labor productivity, reduced crop yield potential, increased droughts, increasing flood events and extreme storms are all undermining food availability and food access. Another very obvious impact of climate change has been the wildfires. We've seen quite dramatic wildfire seasons over the past years, including in the US, in California. And obviously, most of them are generated by human activities. They're started by human activities. But what we're seeing more and more is that the environmental conditions, the climate conditions, are becoming more suitable for wildfire spread. And what we monitor here is human exposure to days of very high or extremely high fire danger. And we see that in 60% of countries, human exposure to days of very, very high danger of wildfires has increased in 2017 and 2020 with comparison to a baseline of the beginning of the 2000s. When we look at direct exposure to wildfire, also through remote sensing, we see that 72 countries around the world saw an increase in human exposure to wildfires also in this time period. So this is both a result of human activity, human mobility and increased exposure, increased wildfire events. Both are playing a role. Interestingly, also here we have, if you remember the Australian bushfires of the early 2020, which were absolutely devastating, also a detection attribution study showing the influence of climate change on that event. And with the changing temperatures, changing weather patterns, and changing precipitation and humidity, we're also seeing that climate-sensitive infectious diseases are starting to shift. And what we monitor here is 4 climate-sensitive infectious diseases of great public health concern. The first is dengue. Dengue is the fastest spreading vector-borne disease in the world, an enormous burden of disease, particularly in South America, Southeast Asia. We also look at malaria. We look at Vibrio cholerae in particular, and at other vibriosis or Vibrio pathogens in natural waters. And as you can see, climate change is driving increases in the environmental suitability for the transmission of all of these diseases. Malaria, we're seeing that highland areas, particularly of low human development index countries, mainly Africa and Asia, are becoming more and more suitable for the transmission of malaria. And what's seen on the ground is that you increasingly start finding malaria in places, in highland areas that were previously considered relatively protected from malaria. So new populations getting exposed. And what this looks like, if you look at a map, we're trying to develop that for this year, you see the latitude. So these diseases that generally tropical going further up and further up and further up. So new populations being exposed to diseases that they don't know how to treat, they're not used to diagnosing, and they're not used to having to deal with. And with this, I've shown you a few, but the health impacts of climate change are very interconnected, are very multifactorial, and they add on top of each other. They're occurring simultaneously. That is the most concerning thing. They don't happen in isolation, and they're starting to undermine all of the foundations of good health. The example of Canada is a really, really great example of what a cascading crisis looks like, because we were in the middle of a COVID pandemic when health systems were already overstretched and quite struggling quite a lot with them. And at the same time, we had this heat wave that reached almost 50 degrees in Canada, people having to go to cooling centers, being all together during a global pandemic when people were actually being asked to isolate. And obviously the toll of that heat wave itself was particularly strong on the urban poor, on the most isolated communities, and on the elderly. And during that heat wave, because of the extreme temperatures, we saw this also quite devastating wildfires throughout the region. And the important thing is that those wildfires did not only generate immediate destruction, but also through soil erosion. They were one of the factors that the floods that followed that year were attributed to. So also through that degradation of the land, the flooding event that followed. So these are cascading events. It's quite a shocking example from Canada. And obviously with these increasing hazards of climate change, we need to start doing something to reduce our risks, our health risks. And this is the framework of the previous IPCC report, trying to look at where we need to action to reduce the risks of climate change and therefore the impacts. So when we have hazards increasing, it's extremely important that we try to minimize exposure. We try to minimize human vulnerability. And that is where adaptation becomes so relevant. Also, obviously, reducing the hazards themselves through accelerated mitigation. So the kind of the most obvious adaptation to extreme heat is the use of cooling services. We're increasingly adopting unsustainable cooling practices as a result of the rising temperatures. And what you can see here is an indicator that has three components. The one of it is the proportion of households with air conditioning around the world, increasing as you can see here. The heat-related deaths averted by air conditioning use also increasing because obviously it is a very effective protective measure to extreme heat. And this is the carbon dioxide emissions that come with that. What I'm not showing you here that we also have is the data that is linked to the air pollution that comes from the overuse of air conditioning, the deaths associated to that air pollution, and the fact that air conditioning units release heat to the outside, release heat waste to the outside, and therefore contribute to increasing the urban temperatures through and contributing to the urban heat island. So while they can offer some protection to the inside, they increase air pollution, they increase temperatures in cities, and they contribute to exacerbating climate change. So it's a classic example of a very poor adaptation strategy, what we call a maladaptation strategy. On the other hand, a very good adaptation strategy to extreme heat is increasing the availability of urban green spaces, because urban green spaces help reduce urban temperatures, reflect heat, absorb heat better. And they also have enormous health co-benefits. There's very, very good studies, particularly in the US, showing that exposure to urban green space helps reduce all-cause mortality, helps improve cardiovascular health, helps improve mental health, also provides a space for recreation, for social interaction, social engagement. And they increase also the value of the territory. So while very, very desirable, what we are monitoring here is the degree of urban greenness of different cities. And what we're seeing is that only 27% of urban centers around the world were being classified as moderately green or above. There's some improvement, but still really insufficient. There's still an enormous opportunity here to invest a bit more in urban green space, urban redesign to protect health. That would also have, although it's not the main component of it, capacity to absorb greenhouse gases, and also to clean the air and provide better air quality by increasing exposure to trees and greenness in urban centers. And one thing that is perhaps quite concerning is regarding the extent to which countries are putting forward policies and implementing programs to build resilience in their health systems. What I'm showing you here is the level of implementation of the national health emergency frameworks, which are mandated and they're obligatory, they're mandatory under the international health regulations. This is data reported from 2020, and in 2020, only 75% of countries said that they had implemented at medium to high levels their national health emergency frameworks. These are frameworks designed to help countries protect themselves from any public health emergency, including a pandemic like COVID-19, including a health emergency driven by climate change hazards. And perhaps the most concerning thing here is that if we look at the different countries, it is the very high Human Development Index country group that implemented the most percentage, the highest percentage of the frameworks at roughly 90%. But the low and medium Human Development Index countries, the most vulnerable, are the ones that are lagging behind in their implementation, which leaves them in an increasingly vulnerable situation. So again, our response to climate change widening the inequities gap. But of course, there's limits to adaptation, also from the IPCC report. What this graph is showing you is the adaptation or the level of risk that we would reach with very with the maximum level of adaptation, which is shown here in red. And in yellow is the level of risk that we wouldn't get away with reducing, even with very, very aggressive adaptation. So this shows us that it's really urgent to mitigate climate change anyway. On a trajectory of high carbon emissions, we would not be protected from the hazards of climate change. And the important thing is that in acting in the face of climate change, as I said, we would have the biggest global health opportunity of the 21st century because of the health co-benefits of climate change mitigation activities. The first thing that we look at here is the energy system. The energy system is by large the largest contributor to global greenhouse gas emissions. So, and importantly, it's also the sector in which we have the opportunities to decarbonize. We have the best chance to decarbonize. And the encouraging thing is that it is the very high emitting countries, China, the US, Germany, India, that are most rapidly accelerating the adoption of clean energies in the energy sector. We're seeing an average increase of 17% of electricity generation from 2013 to 18. And it has reached, I think now that the levels are roughly at 8% of all electricity generated globally, which is obviously really, really encouraging. However, when we look at what the energy system is contributing to anyway, the carbon intensity of the energy system, the amount of carbon dioxide emitted per unit of energy that we're generating, has remained fairly constant since 2014, since 1970. And since 2014, the pace of decrease has been just 0.6% per year at a global scale, which means that it would take us 150 years to fully decarbonize our energy system. That is really not meeting the mid-century goal of full zero. We're off by 100 years. And we have the technology to do it. That's the irritating bit. What you can see in this graph is the decarbonization in the energy sector of countries with very high human development index, high human development index, medium and low human development index. And these trends are quite interesting. Very high human development index countries, by and large, are adopting these new efficient technologies for low carbon energy generation. They're enjoying cleaner airs, they're enjoying the benefits of that transition. High human development index countries are perhaps now starting to go that decarbonization route, but the medium and the low human development index countries are still growing their economies and developing as they should based on a high carbon system. And there's again here an inequity in the capacity to adopt cleaner technologies and to decarbonize. And the most disadvantaged countries are being again left behind in a global transition to a low carbon economy. So this highlights the needs of actually contributing to the Paris Agreement goals of financial support to lower middle income countries. And I was mentioning about the co-benefits. The most immediate co-benefits of decarbonization, of reducing fossil fuel burning, has to do with cleaner air, with reducing emissions of harmful particles in the air. PM2.5, 2.5 micron in diameter particles are the most harmful forms of air pollution. And what we're tracking here is the deaths that are attributable to PM2.5 pollution by source. And we estimate that about 3.3 million deaths come from PM2.5 pollution, and about 1/3 of those deaths are directly related to anthropogenic activities. The interesting thing is that coal still makes up the majority of the deaths from PM2.5 that come from power plants. So we're still using coal for power generation. That has an enormous toll on our health. So again, the benefits of decarbonization. Another interesting finding here is that the high human development index countries, the most industrialized countries and the wealthier countries in general, have lower level of air pollution or deaths associated with air pollution. And that's a combination of cleaner technologies and better air quality control measures. And when we look at household energy, what I showed you just now is ambient air pollution. I haven't even started counting indoor air pollution, which is much more challenging to capture. But when we look at the use of household energy, the shocking finding is that only about 5% of rural households in the low human development index countries have clean fuels in the domestic sectors and use clean fuels in the domestic sectors for cooking. 95% of rural households in low human development index countries are still cooking with dirty fuels. Also an enormous gap here by gender, with women generally more exposed to cooking air pollution in these countries. And generally around the world, you see a big gap between urban and rural populations in their access to clean energy, something that the Sustainable Development Goals are asking us for us to improve. The other big sector of health co-benefits obviously has to do with the agricultural sector. The agricultural sector, or the food sector in general, contributes to around 20 to 30%, according to the estimates, of all global greenhouse gas emissions. It's an enormous contributor to greenhouse gas emissions. So what we're monitoring here is the contribution to greenhouse gas emissions from the agricultural sector by type of food. And as you can very clearly see in this graph, is that cattle milk and cattle meat by large dominate all the emissions from the agricultural sector. And that is because A, we consume a lot of cattle, and B, because cattle are ruminants, and ruminants release a lot of greenhouse gas emissions in the form of methane from the fermentative process, and also contribute to land use change, which also generates greenhouse gas emissions by mainly through deforestation. So what you can see here is that enormous contribution. And the very high Human Development Index country group is the one in which cattle, meat, and milk contributes to the most emissions. It contributes to around a third of all the emissions in the very high Human Development Index country group. So reducing red meat consumption can have enormous benefits in terms of reducing greenhouse gas emissions. But the important thing is that red meat consumption is also a major contributor to adverse health outcomes from unhealthy diets. So we estimate that globally about 1 million deaths are attributable to the excess consumption of red meat globally. And the very high Human Development Index group is the one that has the most deaths from red meat per capita. So again, transitioning from excess red meat consumption to diets that are healthier, more balanced, and more plant-based can have an enormous benefit, not only for greenhouse gas emissions, but also for health outcomes and dietary benefits. We did this study published early last year, where what we tried to do was to project what different routes of achieving Paris Agreement goals could look like, and how we could get to Paris Agreement goals by prioritizing those activities that have increased health benefits. So that's what we call health in all policies. What would happen if, rather than just targeting Paris Agreement goals, we were targeting Paris Agreement goals, but prioritizing those actions that have health benefits? And the interesting thing is that we found that by prioritizing health in all climate policies, in only 9 countries that we studied, we could literally save millions of lives through that prioritization of health. So talks to the importance of having the health community embedded in climate action and in the climate conversation to ensure that as we do that transition, we maximize health gains. In the case of the US, what we're seeing is that doing a health in all policies transition could lead by 2040 to 36,000 deaths saved from better air quality, 664 lives saved from improved diet, talking about the high meat consumption, and these all dietary factors really of adopting a kind of more sustainable and balanced diets in the US. And 300,000 lives saved from increased physical activities if in that road decarbonization we were to prioritize active forms of travel. So enormous benefits, again, mostly exposed when we prioritize the health in those climate policies. So many potential co-benefits of climate change, adaptation and mitigation in the form of cleaner air, healthier diets, more active lifestyles, transitioning away from fossil fuel use for road transport into more active forms of travel, improved and more resilient infrastructure and public services by strengthening health systems and building resilience in the face of climate change, increased exposure to green space, friendlier cities, and obviously reduced inequities as a result. And because of all of this, because of the huge risks of climate change and the enormous co-benefits to health of accelerated climate action, it is that the health community really should be at the forefront of this fight and should embed this into their practice. However, the health sector contributes to around 5% of all global greenhouse gas emissions. Just to give you an idea, the whole aviation sector contributes roughly to 2%. So if it were a country, the health sector would be the 5th biggest emitter in the world. So it's really, really significant. The interesting thing here is the US. I don't want to blame and shame, but the US is the country that has by far the biggest emissions per capita of the health sector. And the interesting thing of this graph, what this is showing, in case you cannot read it, is emissions per capita versus Human Development Index. A very, very similar graph is shown. If rather than Human Development Index, here we show healthcare access and quality index, roughly the same thing. And what you can see is that up to about 600 to 800 emissions, CO2 emissions per capita, kilograms of CO2 emissions per capita, you see that an increase in emission is associated with better healthcare provision, mostly because you're improving the health system, you're strengthening it, you're delivering more healthcare. But as from about 800 kilograms of CO2 equivalents per person, increasing CO2 emissions is not at all associated with better quality of healthcare, which talks to the inefficiency of this increase in emissions from the health sector. There's a lot that can be done in terms of optimizing healthcare, reducing unnecessary emissions from healthcare while still improving healthcare provision. In the NHS, in the UK, the NHS, the National Health System, in September 2020 has committed to becoming the world's first net zero national health system in the world. We've helped them do the analysis of how they might get there. And what they committed to is to reducing its emissions by 80% with respect to 1990 levels by 2036 to 2039, and reaching full net zero by 2045. And this is taking into account not only their direct emissions, but also the so-called scope 3 emissions, that are the emissions that come from the goods and services that they consume. With this, the NHS is working with different pharmaceutical organizations and medical suppliers, and with all of their suppliers really, to ensure that they meet their climate goals. And the NHS is the largest single buyer health system in the world. It has an enormous purchase power. So it is shifting, it is helping at least companies to shift their practice as well. So it has an enormous cascading effect. And the interesting thing is that in November 2021, during the last COP in Scotland, 47 countries committed to developing climate resilience and low carbon health systems, with 12 of them committing to net zero by 2050. So again, a cascading effect whereby when you have a big actor committing to a transition, that generates the possibility for others to follow suit. So again, this from the health community committing to not harming health through contributions to climate change is enormously important. And this is the last thing I'm going to show you. I tend to close on this very depressing slide because it's the one that outrages me the most. I've showed you many of the health impacts of climate change. I've shown you the enormous health opportunities of climate action. And still, out of 84 countries, which contribute to about 90% of all global emissions, 77% are still subsidizing fossil fuels. So they're still using taxpayers' money not to promote the transition to a healthy low carbon future, but actually to fuel the climate crisis, quite literally. The amounts of money that these countries have put into subsidizing fossil fuels is in many situations even more than the total budget they allocate to healthcare. 10% of countries allocate more money to subsidizing fossil fuels than to their health systems. So again, this talks about priorities. If we keep on subsidizing fossil fuels and generating financial incentives for fossil fuel burnings, the transition to a healthier, low carbon future will be virtually impossible. And the key here is to ensure that those taxpayers' monies that are going to harming their health through fossil fuel burning, rather are redirected to activities that provide health and well-being gains for vulnerable populations. So there are ways of redirecting these funds that generate more health and more well-being. So with that, I will just close and remind you that it is not a technical, economic, or financial question of whether we can meet Paris Agreement goals. We have the technology. We have a lot of money that we're putting in the wrong places. The problem is political, it's entirely political, whether we're gonna commit or not to make this transition. And with that, I'm just gonna close and invite you to visit lancetcountdown.org. We have a data visualization platform there where you can explore more of our indicators in a bit more detail than what I've shown today. And with that, I'll be very, very happy to take any questions.
Thank you so much for all of that. We have had quite a few questions come in, but I think we're going to start it off with Dean Irwin. Was there anything that you wanted to ask Dr. Romanello?
Sure. Thank you for a fantastic presentation, Dr. Romanella. Just quite expansive in what you have provided us here. One specific thing that I'm curious about, the slide that you showed about the benefits of air conditioning, and yet also the harms of air conditioning in terms of CO2 production. Have there been studies to look at the equivalent impacts of using fans rather than air conditioning? Because it's often not the temperature of the air, but the movement of air that produces the cooling mechanism for someone suffering from heat exposure. So can you please address that question?
Yeah, absolutely. That's an excellent point. There's one of our collaborators called Oli J that he works a lot with, also with Dr. Chris Ebi, and they have particularly been looking at that question. He's a physiologist looking at heat and health, and they have been looking at how you could achieve good, effective cooling to protect vulnerable populations through lower energy consumption means. And fan use has much less emissions. I don't know the numbers, but it's less than 1/10 of what you would achieve through air conditioning. But it's also not as efficient, particularly when things get really hot. And one of the interesting findings actually that they had is to look at the most vulnerable populations, those that really are almost energy dependent in their need for cooling, and how you can reduce the energy consumed by air conditioning units if you simultaneously use fans. So if you combine air movement with a slight reduction of air temperature. So it's a very interesting study because obviously very vulnerable people are absolutely reliant on air conditioning, and sometimes when the temperature goes above a threshold, particularly in humid days, air movement is not quite enough and you have to offer cooling, especially as temperatures start reaching 50 degrees. But that is a very interesting kind of low energy combination. So the key there would be to encourage both transitioning to more sustainable cooling, sustainable buildings in cities where you have these glass buildings that are basically greenhouses. Temperatures get really hot, and that's really not something that we can continue doing in a climate as it goes forward with such temperatures. But investing in better and more efficient cooling technology, there's also a big gap there that could lead to much better health outcomes and lower energy consumption as well.
Great. Thank you so much. Kimberly, back to you to handle the audience questions.
Yeah, absolutely. So if anyone in the audience does have any particular questions, we've had about 5 come through so far, but you can utilize the Q&A box at the very bottom of your screen and we'll get to those one-on-one. One of the questions that I had for you was, I was recently on Twitter and I saw a climate scientist say that the only way to get governments to pay attention to climate change is to make it reminiscent of the space race and almost give bragging rights to whoever's doing the best. So I was just curious what your opinion was on that, if you think that that's really what it's going to take. Your last slide really made it seem like there's got to be some other force to make it a priority for governments.
Look, I don't know if governments, but definitely private companies. Private companies that start attracting buyers, attracting investments, by using the low carbon transition as a marketing tool. That's definitely an area that needs to be further explored. There's very interesting initiatives in terms of adding carbon footprint to commercial products, particularly to food products. And more companies are starting to leverage on this kind of sustainable marketing, let's say. There's a trick there, obviously, of greenwashing. So we have to be a bit careful about those claims and those sustainable claims. There's also kind of the green tax, that green products, just because they're green, they get their prices go a bit further up. But there's definitely a lot that can be done there in terms of that kind of marketing and branding. When it comes to countries, that requires collective action. So what you have countries championing this, and you can have countries that take part of it. The European Union is doing a lot in terms of decarbonization. It's really been leading much of the decarbonization transition for quite some years now. It does require collective action. So the power of countries to shift is the same as I was saying for the NHS. The power of big countries to shift cascades to other countries too. So it's more than kind of a race. It does become this kind of collective inertia towards a low carbon transition.
Yeah, absolutely. Well, we're going to go ahead and get started with the Q&A. So the first question that we had come in for the heat-related deaths, is there any reason to believe that these deaths are being underreported? They said, I expected a higher number in certain countries.
Yes, look, it's heat-related mortality is really challenging to track. And that is because countries generally don't monitor daily mortality, or at least don't report it. So knowing exactly what the excess death during heat waves is really challenging. And there's a couple of projects going on, particularly led by the London School of Hygiene and Tropical Medicine in London, where they are trying to capture bottom-up that information. And what we do see is that exposure response and that modeling that we use probably underestimates heat-related mortality in many places, because it does not take into account the lack of adaptation, the maladaptation. It just takes into account basically temperature and a constant adaptation throughout the world. So likely would be very different. The interesting thing about that, those findings, is the direction of travel more than the absolute numbers of heat-related mortality. And then the other thing with heat-related mortality is that it's much easier to adapt to cold temperatures than it is to hot temperatures. There's a point when you cannot wear an extra sweatshirt or remove an extra sweatshirt to be less hot. And if you look at the exposure response curve for cold temperatures, the mortality goes up as temperatures reduce, but quite slowly, whereas for hot temperatures, they really sharply go up. So there's also there in that exposure response function a big unknown, because we don't have much data of extreme temperatures as the ones we're seeing. And more increasingly, we're seeing temperatures of 50 degrees, and we don't have much data to tell us what is the response in terms of mortality when a place gets as hot as 50 degrees.
Very interesting. The next question is very similar to that, and also kind of copies off of what Dean Irwin was saying, talking about more emission-safe ways to provide air conditioning, but they specifically mentioned solar roofs. Are solar roofs a good alternative to powering AC units, and what's the emission kind of impact from that?
Yeah, look, it's very interesting. We should really be covering our roofs with solar panels, shouldn't we? In most of the models of low carbon transition, even if you were to absolutely cover all of the roofs with solar panels, you wouldn't be able to put up with the energy demands of a house that has such high energy use. Air conditioning units in general are really energy consuming. They consume a lot of energy, so it would be really hard to make up to that energy production only through solar panels. But definitely we should also be using solar panels to reduce our reliance on the grid. The renewable energy is generally more efficient at a large scale. So you have a lot of solar energy fields, you have wind energy fields, and they are even not being enough to compensate to our energy demand. So upscaling that to a point when you can also afford the amount of air conditioning that we're using is virtually impossible in our current trajectory.
So the next question that we have is, an attendee was saying, if they were reading that right, it seems like emissions from agriculture are declining over the last 10 years or so. If that's correct, what's causing that? What's driving that?
They're not declining. They're increasing because of the volume increasing. The per capita emissions are roughly constant. And that's because you have transitions in both directions. But they're, I don't remember now the actual values, but they're fairly constant with a slight increase. We have updated that indicator this year, so we will have the global figures soon. In the very high human development index group, you have reduced emissions from the agricultural sector that comes from efficiency embedded into the agricultural sector, and from a reduction of red meat consumption, which has been happening over the past years. There has been a transition towards lower red meat consumption, but that hasn't been enough to tilt the overall increase in demand for agricultural products at a global scale.
That makes sense. So Sean is asking, what is driving emissions in the US healthcare system that countries with similar populations or similar health systems don't have? Why are we so bad?
You have a good health system, let's say that. There's an overuse of healthcare in the US. There's pros and cons to that. You have generally private healthcare, which makes resource use have a very, very different pattern approach than health systems that have public structures. There's an overuse in general of many things. You have an overuse of medicines. The supply sector is by large the largest contributor to all the emissions of any health sector. And you have an overconsumption of drugs in every country, particularly in the US. You have an overuse of medical resources, and your buildings are also very inefficient in terms of their energy use. So you have a combination of everything, but it's some of those things that require a bit of a shift in the way that healthcare is provided, but there's a lot of learnings from other health systems that could contribute enormously to reducing emissions in the health services in the US. There's a group particularly led by Jody Sherman at Yale, and she's looking precisely into that, into where the excess emissions from healthcare in the US are coming from, how you can firstly optimize healthcare use, reduce the pressures to the health system as well, and at the same time start decarbonizing so that you can then reach full zero. The other element of it is as well another side of the co-benefits of climate mitigation through healthier diets and more physical activity that has to do with preventing chronic disease and improving health outcomes. And if you deliver those, they're generally very sensible public health interventions when you talk about increase your physical activity, reduce your exposure to air pollution, eat better, eat healthier. That would also help reduce morbidity, and as a result of that, also reduce the over-demand on healthcare because you have a healthier society. So there's many different elements to healthcare emissions that could be addressed through climate action.
Yeah, it seems very multifaceted. The next question we have comes from Megan Colley, and she says, what level of incorporation of a One Health framework does the Lancet Countdown utilize? More specifically, do your indicators include the shifts in vector-borne diseases, such as illustrated of climate and human migratory shifts?
Mm-hmm. Increasingly, we're trying to explore a bit more of that. We try to focus, so the One Health approach is a lot wider than our approach. And it incorporates also things like environmental degradation, ecosystem destruction, which don't directly always relate to climate change. So we don't focus on that specifically, but what we do focus on is things like environmental suitability for vector-borne diseases. And in that, we do track, for example, mosquito populations. So we do track the shift in where those mosquito populations are being newly found. And much of that has to do with the One Health approach and has to do with environmental degradation, which we don't directly monitor. We also look at things like, well, anything having to do with cattle, with agricultural service, and with land use change associated to that is something that we also look at. And we try to take a holistic approach, but always with the focus of what is the climate change link with that One Health approach. So embedding it through climate change.
Well, thank you so much for all of your time. I know that you are doing a lot of really important work at the Lancet Countdown. How can people stay in touch with you? What social media do you guys use? If people want to learn more, where should they go?
Look, Twitter is probably the best place as ever. At Lancet Countdown is our handle. We also have a webpage, so I would advise that you go and look at our webpage, just because that's where we have the data presented, and it's a platform that's quite fun to be playing around, if not a bit depressing. But there you also can explore our indicators at a country level, which is quite interesting. We have a news section there, and we try to keep updated on social media. We're going to be launching a few reports this year, probably closer to COP. We're going to have our report, the global report, being launched probably in November. And we're also going to publish reports from our regional centers shortly too. So yeah, keep an eye out for that.
On behalf of the Lister Hill Center, thank you so much for your time. We greatly appreciate it.
Thank you so much.
Thank you, Dr. Romanello.
Thank you, Dr. Erwin. Such a pleasure.